The following video is an amazing one that may never have been filmed before. This is the real-time cure of a young woman with anaphylactic allergy to a variety of foods. What has happened previously in your exposures to fish?
So essentially it's swelling of the throat, and mouth, and lips. But the last exposure was approximately, it was Father's Day last year. And it was, I don't know what the fish was, because it varies from species to species, but I had experienced swelling of the lips and also of the kind of jaw area. And it took probably, it took like a week for it to go away completely.
So how long did it take for your symptoms to onset last year when you were exposed to the fish?
Probably, like the swelling started like within minutes.
How many minutes? 5 minutes?
I don't know.
10 maybe?
Less than that.
Less than 10,
like 2
okay.
minutes.
Okay.
Tops. And it continued to swell for half an hour until I actually got to it.
Okay.
But at the same time, I took an antihistamine immediately, so that slowed the swelling.
So you realize that after I treat you, that what we'd like to do is a test exposure, and that it would be incremental test exposure. We start out by looking at what it is, by then smelling what it is, by doing a rub test on the lip, and we might suggest that perhaps even on the tongue. I wouldn't have you actually eat anything tonight, but certainly that would be enough to provoke a response, would it not?
Yeah.
And you also realize that you could have a reaction. You might have to go to the hospital. Is that okay with you?
Yeah, I brought my EpiPen for
You have your EpiPen, and you're prepared to use that if you need to use that.
Sure.
Okay. Following fairly well. There are information faults compromising awareness of the condition, and there are information faults contributing to pathophysiology or reception of symptoms. So we're going to make a scan for these issues. And no blocked healing issues, so we're going to go directly to subject matter. So, first thing that we'll do is look at information faults compromising awareness of allergy triggers, and I think we'll put in a transform from to state. Transform from state includes anaphylaxis to fish, shellfish, chicken. Transform to state includes perfect neuroimmune acceptance of fish, shellfish, chicken. Anaphylaxis is not allowed. Well, in terms of what we were talking about earlier, that's an actual consideration. I mean, it's simply not allowed in the transformation that we're specifying. We're specifying a set of rules that the universe will reconfigure to, and that's not allowed. We're going to look at information faults around these issues, and now we're going to look at identifying allergens. Let's just do a little bit of test exposure stuff. So, is any level of the ACS aware of information faults in regard to this setting, the contemplation of exposure to these foods? Are there none? There are? There aren't. Good. So, and you've seen them. Are there information faults related to seeing these foods? To your history with these foods, to your future with these foods? Are there none? Are there information faults compromising the validity of this response? Are there none? So, and let's have you just take a smell of this. So you can't smell something without taking some of those molecules in. So that was mackerel. And is any level of the ACS aware of information faults in regard to this exposure? Is any level of the ACS aware of the possibility of anaphylaxis or adverse neuroimmune response to this substance? Is there not? And now let's try the chicken. It smells like cat food, doesn't it?
It really does, actually.
So, is any level of the ACS aware of information faults associated with this exposure? Is any level of the ACS aware of this substance capable of triggering an adverse neuroimmune response or anaphylaxis? Is there not? So the next test that I'd like to do is a rub test, if that's all right with you. And so we're going to rub this all over your hair. We're going to rub this on your lips. And the idea is, and this is kind of like a subcutaneous test, we're actually going to be driving some molecules and fibers past, there are only 2 or 3 layers of cells on your lip. It's very thin. And so let me just go ahead and do that. Just tighten your lip across your lower teeth. Okay. So, messy, but otherwise fine. So, are there information faults associated with these exposures? Are there not? Will any of these exposures as ingestants create an anaphylactic response? Will they not? Will they create any allergy response whatsoever? Will they not? So, let's just wait a minute, relax, and see if you notice any tingling or redness or irritation. I've rubbed the heck out of your lower lip. So, I had to put you in a headlock just to hold your head still. But there's some abrasion. But I think you can tell the difference between the abrasion and the anaphylactic response. So we'll just hold on here. I might just go back right now to the pathway and ask, with regard to fish, chicken, shellfish, is total system burden of these allergies log 504, 3, 2, 1, 90, 80, 70, 60, 50, 40, 30, 20, log 20. It's just getting better and better, at least according to the testing. Are you noticing anything?
No.
I don't see any redness or anything like that, aside from the abrasion. So are you noticing anything at all?
No, it's actually amazing.
So would you expect that that degree of exposure would have done something?
Yes. Yeah. For sure.
Okay. So I think what I'd like you to do is just go ahead and kind of chew that up. Don't swallow any of it, and spit all of it into this. Because again, I don't want to sit up with you in the ER if you have a problem. And
Okay.
So no.
Okay. Great to go back to my cat.
Yeah, you should upgrade their chow. Oh, thanks so much.
Sorry. You're so helpful.
So let's have you hold right there and resist. And are there information faults associated with exposure? Any adverse influence at all from this exposure? Is there not? Ready for the next exposure. So mackerel for you. Almost like the little kids. Here comes the airplane. It's not real tasty.
I can do this one.
Oh. So, are there information faults associated with this exposure? Are there not? Is there any adverse reaction that may occur as a result of this exposure? Is there not? Are there information faults compromising validity of this response? Is there not? And how's it tingling right now?
It's really minimal. It's barely there. There's like some in my throat, barely, because I just there's a nice lot of cold. But this is completely unprecedented.
Unprecedented. But this is a really good example of how absolutely straightforward and classical the responses can be. We treated one pathway. One pathway. We were very careful about doing the information fault query and corrections. We were very careful about sequencing the exposures, smell, sight, smell, the rub test, and the taste test. But it's a pretty good response. It's been about 10-15 minutes now, and I think if you were going to have a type IgE immediate response, that you'd have had it some time ago.
Yeah, it's true.
But it didn't happen. Your voice isn't rough or raw or so there you go. So, well,
Okay.
I think we're all done. Congratulations.
Thank you so much.
That's good.